All right, let's get started. Hello, everyone. Welcome to this webinar called Vaccine Management on Salesforce, Managing Vaccine Administration at Scale. My name is Diana, and I am with CRM Science. Thanks for taking the time to join us today. I want to start by introducing CRM Science real quick and sharing some highlights on the next slide. For those of you who don't know us, we are a Salesforce Gold consulting partner. We are also a Salesforce.org impact partner. And what that means on a day-to-day basis is that we help our clients maximize the value of the Salesforce platform. As you can see here on the slide, we are a full service consulting firm. So you can count on us from anything from strategic consulting to implementations, custom development we do as well. And we take it all the way through to user experience, user adoption. We do the training, and now you can also count on us for delivering vaccine management solutions. On the next slide, I have a couple of things to mention here. Everyone is muted today, but we do encourage you to ask questions. Please use the Q&A feature for that, and we'll do our best to answer as many as possible towards the end of the webinar. And then lastly, we are recording the slides as well, this webinar as well. So you will be receiving the slides as well as the replay to this webinar probably later today. And with that, I'd like to hand it over to our speakers today. I'll let you all introduce yourself, and then we can get ahead with this webinar.
Hi, everybody. My name is Michael Beswick. I'm the practice lead for enterprise here at CRM Science.
Hi, my name is Linda Johnson. I'm a senior business analyst here at CRM Science.
Hi, everyone. My name is Philip Ost. I'm a lead solutions engineer in Salesforce.org, covering large NGOs.
Oops. Okay, Philip, I think you're going to take it away.
Oh, right. So, well, everyone, as we're all aware, we are now in the middle of a pandemic. We have been for about the last year. And with the advent of recent vaccines being released, it's now become imperative to find our way out of this problem. Delivery and management of vaccines is going to be a critical component to how we're going to address this. If you could move next slide, please. So there are basically 6 basic obstacles that we're facing in this environment. We have a limited vaccine supply. I think everybody's aware of that. But in addition to that, you're coordinating distribution amongst many different vaccines. And this is something that really hasn't happened before for a lot of organizations. Even those that are familiar with delivering vaccines, juggling various vaccines and making sure you're coordinating that inventory properly isn't something that's typically happening. Also, across the various populations that we're going to be delivering vaccines to, this is a very broad swath of individuals. Typically you may see vaccines being delivered maybe at the broadest as flu shots. But in this particular case, we don't really know, because there hasn't been enough testing, whether or not there are certain specific groups that may have different reactions to various vaccines. So for example, a group with diabetes may have a different kind of response to certain vaccines than others. And this just isn't understood. Additionally, the volumes of vaccines we're administrating is going to be huge. I mean, the target is basically everybody, right? So that's a lot larger than getting smallpox shots to a bunch of second graders. As a result, how the systems have to manage this and the scale at which they have to be able to deliver against is a scope that just hasn't been tackled before. We don't know what the adverse reactions are. So in addition to whether a vaccine is going to work well for some people who have diabetes, will it also have bad reactions for other populations is something else we need to track and understand. And then lastly, communicating with the public. I think everyone's well aware that there is going to be some skepticism and some resistance to accepting broad acceptance of a vaccine. I think that that's kind of warming up to people these days, but certainly engaging with the public, making them understand not only the parameters of the efficacy of the vaccines, but who's going to be available to get a vaccine, registering them, scheduling them, making sure that they come in, and making sure that we do this in an equitable fashion so that everyone understands that they're just as important as everybody else. Obviously, we have a priority list on those who are most vulnerable and those who are most critical in our societies, but still, nonetheless, we want to have that communication with the public so that everyone feels like they are included in this process. Next slide, please.
Yep.
So Salesforce has approached this from the perspective of how do we tackle those 6 unique elements to this scenario. We've been delivering vaccines on a routine basis now for years now, for decades, and these are the 6 problems that we're trying to actually address. The way that we do this is by leveraging various components of the Salesforce platform and bringing them together into one unified solution that helps organizations address their specific needs. Not every organization has the same needs. You may be dealing with a controlled list of a population, say at a university, or you may be dealing with the entire population of a state, which is pretty open-ended. And these are different components that are going to bring about different focus in certain areas of the platform to help you meet those requirements. But generally speaking, we can say that we're delivering a command center so that you'll be able to gather the information available both publicly and the information you're collecting as you're engaging with your constituents to deliver the vaccines, and bring that together into a place where you can visualize and see what the impact you're having is and how to plan and organize and coordinate with any other organizations that you need to work with in the process of delivering the vaccines to your population. Additionally, inventory tracking. Now, there are already inventory management systems in place in health facilities and whatnot for dealing with a lot of the vaccines. And we've all heard stories, I think, about how some of the vaccines take like 75 degrees negative to be stored and things like that. But just tracking what you have on hand and knowing where you're at so you can plan accordingly and engage the right population at the right time is going to be important. Appointment scheduling is going to be important also. How do I engage with the population at large, get them into a process, and then make sure I parse them into quantities of allocation so that I don't overextend my inventory. Health notifications also for the broader notification of the public, and as well as managing the outcomes that everyone has. And then lastly, administering the vaccine itself and what data needs to be captured there. Because recall, all of these vaccines take multiple dosages. And when you add that layer of complexity into the situation, you now have to have the ability to understand who got one when they have to have another one, and make sure they don't miss that window of opportunity. These are all complexities that we really haven't dealt with before. But to summarize, Salesforce has developed a platform-based solution that ties this together and allows you to pull and select the components that are most important to you to go ahead and deliver an effective program.
All right, so here at CRM Science, we've had a long and fruitful relationship with the National Organization of Retirement Communities. Think the most vulnerable population to COVID-19, as well as frontline medical workers who have to support those people. In the run-up to the WHO declaring COVID-19 pandemic, we were able to identify that we were going to need to support them throughout this pandemic technologically to make their jobs and lives a little bit easier. So as the quarantine began, our client was faced with a number of very specific challenges, not only in safety, but in compliance with the different reporting needs for both state and federal governments. In March, we immediately jumped into action with a plan of prevention and distancing, started with a paper form, and we were tasked to step in and streamline the process to make it faster and easier. We started building our screener application, and the problem that we solved was digitizing the paper form. The form took an extremely long time to fill out. It caused traffic backups. It jammed the streets. It introduced a lot of danger with prolonged exposure in lobbies where people were waiting to fill the form out and standing there and doing it. With the screener application, we allowed for the collection of data quickly and digitally through an iPad so that we spread up the process, cleared the traffic, minimized gatherings in the lobbies, and we were able to build something flexible enough that we could quickly change the persona between employee, visitor, or resident, the questions that were asked, and the decision logic behind allowing or disallowing entry as the regulations were changing and our client was required to provide different data. When work.com became available on Health Cloud, we leveraged the functionality within within to help facilitate the loosening of restrictions over our clients' facilities. One example of how we leveraged it was using Health Cloud and Work.com surveys in order to allow people to pre-screen prior to coming to a facility. And we could inform them before they ever got here whether they were eligible to enter, could not enter, or needed to be tested. We connected this data to the screening application that we had built previously in order to alert guards of the results immediately before they proceeded with the screening, and that also helped save us a lot of time. Finally, as the vaccines became available, CRM Science and our client planned quickly for their vaccine management. We reached out to Salesforce and Phil to see how we could leverage Health Cloud to manage vaccine distribution. CRM Science and Salesforce immediately began diving into the concepts of vaccine management. And with the inspiration of VaxForce, we built a number of powerful declarative functions that leveraged Health Cloud to roll out the vaccine management. We were tasked with quickly providing the solutions to managing the life cycle, and working with the innovative minds over at Salesforce, we delivered those solutions in just a few weeks. Now our client is up and running, administering vaccines across multiple facilities and multiple states, and they're extremely efficient while staying regulatory compliant. Thank you for your time. I will now pass it to Linda.
Okay, so I'm going to talk about some of the things that we explored when we started this project for vaccine management. First of all, we looked at the personas. So we're dealing with two classes. One is employees and the other one is the residents. Because it is built on Health Cloud, we are using the person account functionality to be able to track employees and residents separately. The next thing we needed to do was to be able to get consent. And a lot of what we built is based on the standard forms when you go in to get a flu shot. I don't know if everybody's familiar, but you have to fill out this form. So what we did is we started with a survey to basically gain consent. Based on the questions and the responses, it either came back that yes, I'm consenting and I've answered all the questions that no, I'm not positive for COVID. I haven't had contact. I'm feeling okay. I decline. I don't want to be involved in the vaccination program. Or I do consent, but I'm health restricted. So I answered the 3 questions in a positive manner. This response is then recorded in Salesforce. And basically what it does is it takes this data in, and through automation, we create an immunization record, and we then schedule the employee for vaccination. What we also decided was that we wanted to not only track were they qualified to get the vaccination, but did they decline to get it? And did they also, they're qualified, but at the moment they're not able to get the vaccine. Scheduling is managed by the community, and it's qualified based on the survey responses. There is an email notification that goes out when an individual is scheduled for the vaccine. And there's also a reminder notification so that we can make sure that everybody is aware when they need to come in and they get a reminder. The next thing is on the day of vaccination, when the individual comes in, there is another set of questions that they have to go through. All totaled, there's 11 questions that they have to go through so that we can capture this information. It is up to the administrator to determine whether the vaccine is safe to administer to the individual. And we do capture all this data within a record in Salesforce. Not only do we capture the health information of the individual the day of the vaccine, but we're also capturing the vaccine details. This is just a sample of some of the data that's captured. We do realize that with the COVID-19 vaccine, that in most cases there are 2 doses required. So we built out the functionality that they'll put in the number of doses required. Which dose are you on? So it all starts out with the first dose. You have to capture the vaccine issue date, the expiration date, other details, and then who's administering the vaccine. Again, all that information is captured in Salesforce on a record so that we can continue to track it. If a second dose is required, once the vaccine's administered through the process flow, it actually allows for the scheduling of the next appointment at that time. Now, you don't have to schedule it at that time, but there is functionality built in so that you can make sure that, yes, we get it scheduled for their second dose or for whatever subsequent dose that is required. Again, once the appointment is scheduled, a notification will go out and a reminder. The other thing is the capability with Health Cloud of being able to track adverse reactions. So the adverse reactions can track right back to the immunization record and the individual associated with that. We can track the symptoms, onset date, all the information that we would need should there be any adverse reactions from the individual. One of the things we built out and in our thinking was we wanted to make this flexible enough that not only can we track COVID-19, but right now nobody's really sure, is this going to be just like flu shots where it's a yearly vaccination? Is this a one-time vaccination? But it can be done on a yearly basis. We can also track flu shots, pneumonia shots, shingles, any future vaccines in development. So it has broader implications and broader uses than just tracking for COVID-19. And then some of the account industries that we've identified, of course, are medical facilities, hospitals, urgent care facilities, practitioner offices, elder care providers, education, colleges, institutions, manufacturing. There's now news that manufacturing facilities will be able to administer the vaccine. Nonprofit organizations, Philip's really aware of that implication, airlines, hospitality, local, state, and federal governments. So some of these areas are just involved in a piece of it or the broader piece that Phil was mentioning earlier. Okay. And now we're to questions, and I'm going to turn it back over to Diana.
Yes, thank you guys. Yeah, so to all of the attendees, now is the right time to type in your questions into the Q&A, and we have some time here to answer anything that you'd like to know about the solution. The first question we have is, what are the specific clouds required for this solution? Who can take that one?
I can jump in on that. This is Phil. You know, really the underpinning of the entire solution is typically going to be the Health Cloud. And that's because you're going to be collecting typically personal health data, and the Health Cloud itself is already HIPAA compliant. So that's a big leap forward from having to build something from scratch in any other part of the system. But we also typically see, you know, if you're doing front-end use, the use of experiences or communities. Additionally, if you have complicated workflow or things like that, you're going to be using flows and things like that.
Great, thank you. We have another question. Can text messages be used for second dose reminders?
So I'll jump in there. Any sort of communication prowess that Salesforce has can be used for any of the notifications. So they could be used for scheduling for the second dose reminder. So we can use surveys, we can use text messages through Marketing Cloud. We could use, email campaigns and journeys and things like that.
Just to jump in, we've also tested out using WhatsApp for those who have to deliver vaccines in regions of the world where that's the predominant form of communication for folks.
Yep.
Great. Another question we have, please talk about third-party integrations that might be needed or may enrich this solution.
Mike, do you want me to speak to that?
Sure.
Yeah, so that's going to depend a lot on your situation at hand and any kind of requirements in your local region. You may be required to provide some sort of adverse reaction reporting. If that's the case, there's a nationwide database already in place, which you may have to, it may be requested to integrate to, or just provide files to. Additionally, you may have other systems that you already are working with that you want to use to provide data or integrate with. If you're a very large organization with a large number of employees, perhaps you want to integrate to an employee management system. So there's a variety of different places this can occur. We anticipate that, given the time frame that a lot of people are working under, that they'll be looking for the fastest way to execute these different types of interoperable systems architecture. And I think in a case-by-case basis, whether an integration or some other process that you can support immediately is preferred is the kind of decision that you really need to kind of talk to folks at CRM Science about and see what the best path forward is.
Yep. Thank you, Phil. Another question we have is around the appointment scheduling. Linda, can you please verify if the Lightning scheduler was used for that?
We are currently doing all the scheduling manually. So it is a manual process for the MVP phase of this project. However, we are going to be looking into automating the process and how we go about it. So right now we haven't determined what that's going to be. Definitely something that can be considered.
Okay. And then Michael, maybe you can take this question. Someone would like to know more on the customers who have implemented this. You've mentioned that it's a retirement community, but maybe you could also talk about the number of users and the length of implementation for this solution.
Sure. So our original implementation was specifically around the employee population, with a phase 2 being for the resident population. So that's the medical staff, cleaning staff, things like that. Approximately 1,000 employees. The users on the Health Cloud side, because they have a normal Salesforce instance as well. The users on the Health Cloud side were minimal because we only needed the people who were managing the vaccine to have access to Health Cloud. And it took us about from inception, from them getting Health Cloud to having Health Cloud set up, about 2 weeks, and then another 2 weeks once vaccine management came. That was not because it was phased that way. It was because we were using Health Cloud and we were using Work.com and Health Cloud in a different way, as I went over, as sort of screening before the vaccine management piece came into play. So it was about 2 weeks to launch for Health Cloud. And then later on, a couple months later, when vaccine management came into play, it was about 2 weeks to launch for vaccine management.
Great. Thank you. I have a follow-up question for the scheduling of the appointment. Someone is asking if third-party apps like Fontiva could be used for the scheduling piece.
Mike, do you want to take that, or do you want me to take it?
Well, you can add color. It depends on the capability of the app and our ability to work with it. So these solutions are sort of individualistic pieces built out around the concepts that Phil talked about earlier. So most companies can, they can take what they need and put them in. But we can always, if we have a scheduling app available to us, we can build it to work with the scheduling app.
Great. Let me see if we have more questions here. There is a question in regards to verifying a person's identity before registration and how that would go.
Mike, I can talk to you a little bit about what we've done on our side as the hypothetical.
Sure.
So what we've done in some scenarios is, and this is just kind of the options you have available, is we've sent out, say, a QR code in an email response to the initial registration. We've also requested, maybe through a portal registration, that they upload a photo of their driver's license, something to confirm them. So that way, when they show up on site, they can scan the QR code and/or the individual administering the vaccine or register, bringing them in for their process will have like a visual image from the uploaded photo to confirm their identity. So we've considered that as a possibility. I don't know if in the real world, I don't know if it's become as much of an issue as we kind of thought it would be to begin with. I think that the distribution rollout is kind of right now a little haphazard, so it's hard to kind of say one way or the other. But those are two of the methods that we've kind of incorporated in our basic thinking from the start. I'm sure there's other things we can come up with. I don't know, Mike, if there's anything you can think of also that might address that.
Well, in the practical sense, the implementation that we used had a captive audience, being either employees, residents. So we were able to be very specific about our communication to addresses we knew were theirs. We are going to implement the QR code, as you mentioned, for that identity verification.
Great. Thank you, guys. I think that was the last question here. Unless any of you have anything to add, I think we can wrap up on the next slide. Any last comments from you guys? Nope.
No.
Great.
Yep.
So thanks everyone for joining us today. We really appreciate it. If you'd like to know more about this, it's easiest to contact us via email. The email is here on this slide, contact@crmscience.com. You can also reach me directly at marketing@crmscience.com, and I will make sure your email is routed to the right person here on our team. Like I said earlier, we have recorded this webinar, and you will be receiving the replay later today, as well as these slides that we've presented here. And please share that with your coworkers who could not be here today. We would really appreciate that. And if you have further questions, please reach out to us. Again, thanks so much for spending time with us. And thank you, Phil. Phil, do you have a final comment?
Yeah, I just noticed that there was another question in the chat that we didn't address.
Oh,
so
great.
I'm going to right now. It says, how much variation is expected across the verticals that will need this type of functionality? So before we depart, I'd like to jump on that, if that's okay. Yep. So the way I would look at it is there are basically two dimensions that kind of quadrant out the types of solutions, and you'll probably find yourself in one of these scenarios. The first dimension is, do I have a captive audience that I'm responsible for, or is it a broader unknown quantity of individuals who I have to identify and engage into a program? So that's the first dimension. The second dimension is, am I putting shots in arms and responsible for the process of making sure that that happens? Or am I just tracking for compliance and say my employees or my constituent group have received their vaccinations, and maybe I'm tracking which dosage they're on just to kind of help that process along and validate it. But I don't really have to manage the tracking of inventory and coordinating that part of it because I'm not putting a shot in the arm. And so those are the dimensions I would think of So not really so much across verticals, because I think across verticals, we've seen these different varieties of scenarios. But if you think of it in those two dimensions, that'll put you more into a quadrant where you're going to be similar to other organizations attempting to be responsible for their component of this process. Hopefully that helps answer the question. As it comes to verticals specifically, I mean, you could probably generalize that, the hospitality organizations are probably not putting shots in arms, and healthcare services probably are. But that doesn't really quite capture all the aspects. So hopefully that answer gives you an idea of what you might need to consider and how you should look at the solution in terms of its application to your vertical.
Thank you for catching that question before we end here, Phil. Really appreciate it. Thank you for the great questions, audience today. We'd like to continue this conversation. So like I said, please feel free to contact us at the email address here on the screen. And yeah, be on the lookout for that replay. And we hope to see you again next time on one of our webinars. Take care, everyone, and thank you.